Hello, I am Miss White, and welcome to Chapter 19. We will be discussing degenerative changes in aging. So, first, we'll talk about aging, and aging can be used interchangeably with senescence. Anytime we see the word senesce, that means elderly or older. And when we talk about senescence, that is the changes that lead to diminished homeostasis and increased vulnerability in an older population. As far as life expectancy, this is the age at which 50% of a population is expected to survive, and it is a term to use to describe demographics associated with aging. When we talk about the manifestations of aging, it's multifaceted and it does affect a lot of our systems that we've talked about so far. But overall, you do see increased mortality amongst aging individuals. You do see biochemical composition of their tissues change. You see a progressive decrease in physiologic capacity. There is diminished adaptation to environmental stimuli, and there is increased vulnerability in society. So, up until this point, we've talked about different alterations within the body. We've talked about alterations in elimination, metabolic processes, perfusion, ventilation, mobility, immune response, fluid electrolyte imbalances, you name it. We've talked about all of those things in this class. Well, all of these are essentially manifestations of aging. So, as you review this concept map, think about all the chapters that we've gone through thus far and how that would relate to the aging processes. Overall, it just speaks to as you age, things change and your body is not as effective as it used to be due to the aging process. So there's not necessarily a way to stop it. There's not necessarily a way to make it go away. However, there are things that we can do, as we've discussed in all of these chapters, to either help mitigate or at least minimize the effects of aging in all of these areas. So, as we talk about aging, it's good to talk about what's happening at the cellular level. And what's happening at the cellular level are multiple things. It could be atrophy, which is the non use of those cells. You could have hypertrophy, which is the overgrowth of those cells. You could have impaired mitosis, which is the impaired splitting of the cells and maturation. You can have deposition of lipids. You can have damage from free radicals. You can also have the accumulation of metabolic waste products due to acid-base imbalances, and you can have deposition of lipofuscin. So all of these cellular changes are attributing to tissue changes, which attribute to organ changes, which we see manifest as alterations in your different areas in the body. As we talk about changes on the cellular level, again, that does lead to changes in our organs and tissues. Here we're going to discuss the changes in our skin when we age, and some of the changes you'll see are increased dryness or wrinkles. You may see varied patterns of pigmentation and decreased elasticity. You may even see hair changes such as loss or graying or patching. In the area of fluid electrolyte balance, there is a decrease in total body water because, one, there's body mass changes, and you'll have renal function impairment, and you also have altered sodium imbalances. But the key here is that water balance in the body does determine your sodium concentrations in the blood, and there is a higher risk for hyponatremia in the elderly population because of this, or you may have the reverse where there's too much water retention due to their renal function, and you may see hypernatremia. So here we're talking about the immune response, and you do have immune senescence or aging, and there is diminished antigenic responses. You have a decrease in your T lymphocyte function. Your thymus, where your T lymphocytes originate, have degenerated, and you do see decreased IgE mediated hypersensitivity responses. You may even see enhanced autoimmune responses and also delayed wound healing in the aging population. You'll also see proliferative changes, and again, this has a lot to do with how your cells are growing and differentiate. You may have chronic myeloproliferative disorders such as polycythemia vera or primary thrombocytopenia, which deals a lot with your platelets. You may even see an increased cancer risk due to your impaired immune function. You may see this due to genetic mutations as the individual ages. You may have individuals that were exposed to carcinogens for a long time, or you may even have at the baseline level impaired DNA replication processes. Regarding your neurological function, there are several things that change. You can have alterations in your cognition, sensation, pain, and motor responses. As far as the brain itself, you may see structural changes, including decrease in brain mass. You may see enlargement of your cerebral ventricles, a decrease in the number of neurons or dendritic processes that you may also see a decrease in the myelin sheath. You may even see a decrease in the production of neurotransmitters. All of those ultimately result in impaired connections and processes or communication between neurons, which could attribute to all of the more older diseases such as Alzheimer's and dementia. So, again, these manifestations often result from the structural changes and the functional changes of your cells and tissues within the brain. So, you'll also see issues in mobility directly related to bone mass reduction. You may see something called osteopenia, which means that this is the reduced calcification of skeletal bone mass, or you may even see osteoporosis, which is the atrophy or deadening of those skeletal tissues in the body. You may see hyperkyphosis, where you'll see the spine curvatures and they're in extreme curvature, or you may see chondrocalcinosis or the calcification of your cartilage. There's also the loss of lean body mass called sarcopenia, and this is a loss of skeletal muscle overall. Ultimately, the results are decreased physical activity, changes in your nervous system, and you'll also have protein undernutrition. Next, you'll see issues in perfusion, and as we recall, perfusion is the process by which oxygenated blood gets to our tissues. You see issues with decreased elasticity and particularly decreased elasticity of vascular smooth muscle. You'll also see increased afterload in the heart. You may see left ventricular wall thickness, atherosclerosis, and you may even see reduced density of pulmonary capillaries. Ultimately, this limits the availability of oxygen, which ultimately limits the way perfusion occurs. You can also have other variables that affect cardiac function, such as compliance, cardiac filling. I talked about afterload, but preload can also be affected. Contractility of the heart can be affected. Your ejection fraction, stroke volume, heart rate, and cardiac output can also be affected. Um, your changes with perfusion ultimately results in changes in your ventilation. So you do see reduced ventilation perfusion ratios in the elderly population. You do see reduced ventilatory capacities. You do see increased residual volumes within the lungs themselves. That means there's a lot more air left over in the lungs that they're able to excrete, which could lead to your respiratory acidosis states. You can also see decreased inspiratory reserve volume. So your metabolic processes are also affected. You may see nutrient metabolism issues. You may see obesity or undernutrition. Your endocrine metabolism, you may see issues in the thyroid or parathyroid, the adrenal gland or the pituitary gland, your ovarian or testicular glands. You may see vitamin and trace mineral metabolisms affected, acid base metabolism affected, and mineral metabolism affected, or electrolyte metabolism affected. So, all of these areas in your metabolic processes are affected as you age. I particularly want to point out calcium levels because they are affected by age related decreased intestinal absorption of calcium, and it is a blunted response to vitamin D activation, and ultimately it stimulates the overreaction of the parathyroid. When we discuss nutrition, there is a severe issue in the elderly population due to their deficiency in macro and micronutrients. And remember, macronutrients are those carbohydrates, proteins, and lipids, whereas your micronutrients are your vitamins and minerals. And this can be strained from multiple areas, such as cognitive impairment, anemia. There is an increased risk of infection as a result of this deficiency, and ultimately, you do have poor wound healing as well. When we talk about elimination, we're talking about kidney elimination or with your bladder, and also GI elimination with your bowels. Both of these functions decrease with age, particularly with your renal function. You do have reduced renal blood flow, you have a decreased glomerular filtration rate, you do have reduced renal masses and decreased proximal tubule function, and ultimately you have reduced renin and aldosterone levels, which would lead to issues with your blood pressure management. Um, so when you have issues with elimination, particularly with your kidneys, this can affect other areas as well. Um, your kidneys are unable to excrete drugs even, so sometimes you have to be careful with the drugs that you're giving elderly people because their kidneys are not functioning as properly as they should. You'll normally see issues with urinary incontinence as well because they're no longer able to cognitively hold their urine or physically hold their urine due to urinary incontinence. As far as gastrointestinal issues, you may see that present itself as either constipation, diarrhea, or fecal incontinence. With all that being said, with all the alterations we've discussed thus far in this class, the ultimate goal is to manage those degenerative changes. As I've mentioned in this lecture before, there's no way to necessarily stop the aging process, but we can manage it based off of prevention. You want to help to prevent injury and illness. Therefore, prevention starts with screening. So you have to look at your individual or the population and search for different impairments. And when I discuss impairments, that is functional impairments. And those strategies must be individualized because of the wide range of manifestations that can be exhibited amongst older individuals. So, what that means is that not all elderly individuals have the same metabolic issues or the same nutrition issues or the same perfusion issues or the same any type of alteration. They're not necessarily all the same, so you can't use a cookie cutter method when you're dealing with degenerative changes. Your strategies must take into account comorbid conditions, physical health, cognitive status, functional ability, and social support. So here are concepts that apply to degenerative changes in aging. You may take out your syndrome disease cards and fill them out as we go through these different disease processes. This is called Hutchinson Gilford progeria syndrome, also known as HGPS. I'll normally refer to this as progeria. And this is an extremely rare hereditary disease characterized by accelerated aging. So the individual can be one age, but not necessarily the age of aging. It normally affects the skin and musculoskeletal areas as well as your cardiovascular system. This is an autosomal dominant or recessive mutation in the LMNA gene. And normally you see this presented with individuals that have parents that are advanced in their age, particularly with an advanced age father. You normally see the clinical manifestations within the first year of life. They present with alopecia, prominent scalp veins, feeding difficulties, scleroderma, wrinkled skin, loss of fat and muscle, delayed dentation, and hearing loss. They may have a high pitched voice and a short stature and skeletal dysplasia. And there is also incomplete sexual maturation. Diagnosis includes a history and physical examination. The high hyaluronic acid levels are reviewed, and normally you see high levels of that. And normally you'll see imaging studies done as well. As far as treatment, there is no approved therapy currently, but there is research for this particular disease. They'll look at gene therapy and pharmacological therapy in this research. As far as care, you do want to provide supportive care for the deficits that they may have. So you want to provide feeding care, nutritional intake, activity. That would be PT and OT involvement, joint mobility, monitoring for vascular disease, and also family support. The next disease we'll discuss is osteoporosis, and this is characterized as an imbalance in bone modeling, and it normally favors absorption of bone materials over formation of bone materials. So you have a lot of materials to form your bone mass, but it doesn't actually form. So you do see a loss of bone mass as a result because this process has to be continuous. Um, you do have different classifications, primary and secondary classification, and normally that has a lot to do with your hormonal and genetic causes. As far as risk factors, you normally have a family history of this. You may have a loss of estrogen, there's aging, calcium issues, vitamin D issues, cigarette smoking, excessive alcohol, and a sedentary lifestyle. Your clinical manifestations show up as fractures, especially in your spine and your hip, lots of calcaneus bone in your vertebrae, structural impairment of your trabeculae. You may see thinning and increased porosity in the cortex. You may even see spinal deformities and loss of height. As far as your diagnosis, they may do a DEXA scan, which is specific to osteopenia and osteoporosis. You may look at a bone density scan. They may even look at your bone quality and do a quantitative ultrasound, and they may also look at your Z score classification. As far as your treatment, the goal is prevention. You want to get adequate amounts of calcium and vitamin D. There should be an engagement of regular weight bearing exercise. The individual should avoid smoking and excessive alcohol intake, and also talk to the healthcare provider about the bone health. You want to have a bone density test, and if you are found to be at risk for osteoporosis, make sure you take medication when appropriate. And you want to have an anti-resorptive medication, so that's normally calcitonin, bisphosphonates, and also hormone therapy to replace estrogen that has been lost. Next, we'll talk about Alzheimer's disease, and this is a neurodegenerative disorder, and this is more associated with the tau protein, um, and you may even see amyloid protein in here as well. It is characterized by inflammation and neuronal atrophy, as well as genetic and environmental factors. In general, you do see a global cognitive decline, behavior changes, eventual loss of function in different areas. You do see initial symptoms such as memory loss, confusion, restlessness, mood swings, difficulty interpreting or visualizing information. The severity is based on the stage and progression, and there are 7 stages of Alzheimer's disease. As far as your diagnosis, there's a history and physical examination. You have to have a neurological evaluation for your mental status, communication, ability, memory, comprehension, ability to do math, reasoning, balance, visual and motor coordination. As far as your imaging studies, you have brain scans, MRIs, and CT scans to look at the density of the brain. And the definitive diagnosis is that you have to have an autopsy. So you're not necessarily diagnosed definitively until the individual is dead and they can look at the brain structure itself. As far as treatment, there's no one treatment that would reverse Alzheimer's disease. Again, this is a neurodegenerative disorder, and there is decline in the brain structure and masses with this disease. But you do want to do symptomatic care. You want to maximize the quality of life and promotion of general health status. You want to encourage pharmacological therapy such as central acting cholinesterase inhibitors, antidepressants, anti anxiety agents, and antipsychotics. Well, that concludes our lecture for today. Make sure you review the chapter in the textbook, review your guided learning questions. Make sure you do your system disorder cards, case studies, and activities. Make sure you review those disease cards and guided learning questions. Make sure you do the pathophysiology, clinical manifestations, diagnostics, treatment, and application. And make sure you check your understanding. You want to quiz yourself and others, and you also want to answer the questions in your textbook. And remember, if you have any other questions outside of what you see, make sure you ask your instructor. Thank you and have a great day.